The human brain, it's just this incredibly complex thing, right? And it's locked away inside our skull like a fortress. So that begs the question, how do doctors actually see what's going on in there when something's not right? Well, today we're going to decode the amazing toolkit they use to do exactly that.
Right. So think about it. The brain is our body's command center, but it's so well protected inside our skull that it's a real challenge to diagnose problems. It's not like you can just pop the hood and take a look. So what exactly is in a neurologist's toolkit to get around this?
So here's how we're going to break it down. First, we'll look at how they map the brain's structure. Then, we'll see how they listen to its activity. After that, we'll cover testing function and fluid. And finally, we'll see how it all comes together to assemble that neurologic puzzle.
All right, first up, mapping the brain's structure. Let's get into the tools that create, an actual anatomical map, a blueprint of the brain.
Okay, so a lot of the time, this whole process starts with the oldest trick in the book, a simple X-ray. I mean, if you've ever had a nasty fall and hit your head, this is probably the very first picture a doctor wants to see. It's just a really quick, straightforward way to check for things like skull fractures that might be a danger to the brain. Now, let's talk about the two real heavyweights of brain imaging, the CT scan and the MRI. You can kind of think of a CT scan as a lightning-fast 3D X-ray. It's perfect for emergencies, right? When a doctor needs to spot a bone fracture or fresh bleeding like right now. An MRI, though, that's a whole different ballgame. It uses these super powerful magnets, so no radiation. And it takes a bit longer, but wow, the payoff is these incredibly detailed images of soft tissue. It's the go-to for finding things like tumors or more subtle changes in the brain. So what's it like getting one of these scans? Well, there are a few really important things to know. For both, any metal you're wearing, jewelry, clips, you name it, it all has to come off. And for an MRI, this is non-negotiable because you're dealing with a giant magnet. Now, if you're getting a CT scan and they're using contrast dye, you've got to let them know about any allergies, especially to stuff like iodine or shellfish. And one more thing for the MRI. That machine can feel a little snug. So if you're claustrophobic, definitely give the staff a heads up. But what if you need a super detailed look at the brain's, its plumbing? That's where something called a cerebral angiography comes in. They inject a special contrast dye that literally makes all the blood vessels in your brain light up on an X-ray. It creates this perfect roadmap so neurologists can pinpoint problems like aneurysms, blockages, or even see the blood vessels that are feeding a tumor. Okay, so now we have a map of the brain's structure, but a map of the roads doesn't tell you anything about the traffic, right? To understand what the brain is actually doing, we have to listen in. We need to tune into its electrical and metabolic chatter. And the classic way to do that is with an EEG. That's an electroencephalogram. It's like tuning into the brain's electrical symphony. They just place these small electrodes on your scalp and record your brain waves. It's totally non-invasive, and it's absolutely the go-to test for spotting the weird electrical patterns that signal seizures. It's also super helpful for things like diagnosing sleep disorders. Getting ready for an EEG is actually pretty easy. The main thing is to have clean hair with no oils or sprays so the electrodes can get a good, clean signal. They'll also tell you to skip that morning coffee, no caffeine. And sometimes to kind of poke the brain and see how it reacts, they might ask you to sleep less the night before, or they might even show you some flashing lights during the test. Okay, now if we want to go even deeper, we have PET and SPECT scans. These really show us how the brain is using energy, its metabolism. For a PET scan, for instance, you get an injection of a tracer that's based on glucose, sugar. And since the brain's main fuel is glucose, the scan can literally light up and show which parts are working hard and which parts are kind of slacking off. And this ability to see the brain's metabolism in action, it's just incredibly powerful. Think about it. A fast-growing tumor is super hungry, right? It's just going to gobble up all that glucose and light up like a Christmas tree on a PET scan. But on the flip side, with some forms of dementia, doctors can see these areas of the brain that are eerily quiet, using way less energy than they should. And that's a huge clue for a diagnosis. All right, let's switch gears. Next up, we've got two totally different but equally critical tools. One is a super fast, hands-on way to check someone's level of consciousness. And the other? It involves taking a sample of the actual fluid that protects our brain and spinal cord. In an emergency situation, you just don't have time for a long, complicated scan. And that is exactly where the Glasgow Coma Scale, or GCS, comes in.
It's not a fancy machine at all. It's a simple, standardized scoring system that lets any paramedic or doctor quickly and accurately figure out a person's level of consciousness right there on the spot.
So how does it work?
Well, the score is based on the person's best response in just 3 key areas: how they open their eyes, what they can say, and how they move.
You just add up the points from those 3 categories. A perfect score is 15, and a 15 means the person is fully conscious, totally alert, and aware of what's going on. But a score of 8 or less, that's a really serious sign. It indicates a severe head injury and tells the medical team that the person is in a coma. In literally seconds, that single number gives everyone a vital snapshot of just how serious the situation is.
Okay, now for something totally different. Sometimes the biggest clues to a brain problem aren't in the brain tissue itself. They're actually in the fluid that the brain floats in. It's called cerebrospinal fluid, or CSF. And the way doctors get a sample of it is with a procedure called a lumbar puncture, or a spinal tap.
And this picture shows you exactly how it works. A very thin needle is carefully inserted into the lower back, and this is important, it's way below where the actual spinal cord ends, so it's a safe spot. They just draw out a tiny bit of that fluid, and it can tell them so much. It can show signs of infection, like meningitis, or reveal markers for a bunch of other diseases.
So if you're having one done, they'll ask you to curl up into a little ball. This position opens up the spaces between your vertebrae, making it easier to get the needle in. Don't worry, the area is completely numbed first. And afterward, the most important part is just lying flat for a few hours. That helps a little puncture site heal up and prevents that nasty headache that can sometimes happen if the fluid leaks a bit.
Okay, we've looked at structural maps. We've listened in on brainwaves. We've even talked about analyzing fluid. So how in the world do neurologists take all these different pieces and put them together to actually solve the puzzle?
Well, it really comes together like this. No single test ever tells the whole story. It's all about combining the information. The scans, the CTs and MRIs, they provide the anatomical map. Then the activity tests, like the EEG and PET scans, show the traffic on that map. And finally, those really specific tests, like the GCS and the spinal tap, give them these critical, targeted data points about function and chemistry. It's a multi-layered approach. Which, of course, brings us to the big question. So which test is the best one? And the answer is, there isn't one. The best test is simply the one that answers the specific question the doctor is asking. It's by combining all these different views, from the static structure to the live action electrical signals to the chemistry of the fluid, that doctors can finally assemble a complete picture of our most complex organ. It's what transforms the brain from this mysterious black box into a puzzle that we can actually solve, one piece at a time.